Hello. Thank you for your patience throughout this whole talk or this conference. My name is Eva Vasiljevic. I'm a graduate student at the University of Wisconsin-Madison, and I'm happy to be here to present to you our project on the timing of genetic effects in the Wisconsin Registry for Alzheimer's Prevention. So we were interested in estimating the age when we can observe differences in cognitive trajectories by different genetic risk groups. And our main motivation comes from the fact that there are a lot of studies out there that have established a clear connection between genetic risk and cognition and dementia. But relatively fewer studies have more carefully evaluated the temporal evolution of cognitive decline, especially preceding Alzheimer's disease diagnosis. And this is important because it plays a role in clinical trial recruitment decisions of when people are recruited to trials. And in addition, it gives us some more insights into the temporal relationships for mechanistic insights for Alzheimer's disease. So the relationship between cognitive decline and different biomarkers and which ones occur first and their relationship. And so for this project, we wanted to, like I said, estimate the age when cognitive trajectories diverge by genetic risk. And some innovations to what's already been done are that we'll be using two different measures for genetic risk. Here we're going to be using the ApoE score. I know many of you have probably heard about ApoE itself, the gene that confers a higher risk of Alzheimer's disease. But for the ApoE score, this accounts for nonlinear AD risk. And then we'll also be using the polygenic score for Alzheimer's disease, which has not been applied in this particular context. Of course, it has been in other contexts. The sample is the Wisconsin Registry for Alzheimer's Prevention. This is a longitudinal study with over 16 years of data on participants. And participants were asymptomatic and 40 to 70 years old at baseline. RAP, or the Wisconsin Registry for Alzheimer's Prevention, is considered a preclinical cohort that looks at changes before people develop Alzheimer's disease. The main outcomes that are of interest to us are 4 cognitive composite scores that target different domains. It's either immediate learning, delayed recall, executive function, or a measure of global cognition called the preclinical Alzheimer's Composite 3, or just PAC3. And then our exposures, as I mentioned before, it's the ApoE score, and I'll direct your attention to the table over here on the right side. The traditional ways to model ApoE are to either account for E4 allele carrier status. So ApoE has 3 different alleles, the E2, the E3, and the E4. And those make up 6 different combinations that will exist in the population. And so you can see when we just account for E4 allele status, the carrier status, which E4 is the allele that has the highest risk for Alzheimer's disease, we lose a lot of information when you make it a binary variable. And likewise, with the E4 count, you lose a lot of the information in 3 of the groups. But for the measure that we're using, the ApoE score, it's a continuous outcome that is the log odds ratio of the ApoE allele combinations association with Alzheimer's disease. And then in addition, we'll be using the AD polygenic score, which is a simple polygenic score, but it does include ApoE in it. Go ahead. For the analysis, we used a mixed effects regression, and I'll just direct your attention to the top line because that's probably the most important, where we regress cognition on the main things, age and genetics, but the key factor here is that we looked at the interaction between age and genetics, and we also used we modeled age with up to a cubic polynomial term to account for nonlinear effects. Go ahead. And we estimated predicted cognitive levels across age for different cognitive groups based on those models, and then calculated differences across different genetic groups across time. And so what you see here let's just take a look at immediate learning. Age is on the x-axis, and on the y-axis you have the standard deviation in cognition, and that's the mean difference in cognition. And what are represented by the individual lines there are different APOE score groups, and their difference from what's the 0 line, which is the most common APOE score group, the E3 allele combination, which is an APOE score of 0. And to point out a few things about this. First, on the top row is the APOE score, and then on the bottom row is the polygenic score, which is divided by percentiles. First, we see that there is a nonlinear association between genetic risk and cognition over time. And 2, we see cognitive trajectories diverge at around the age of 65. And then 3, the additional variants that are included in the polygenic score actually don't make that much of a difference in terms of the age when we start to see a separation in cognitive trajectories. Unfortunately, you can't see it because of the closed captions here down below, but I marked the age when we detected a half standard deviation between the most extreme groups of both genetic exposure. So the highest APOE score versus the lowest APOE score, and the highest polygenic score versus the lowest polygenic score. And the difference in age when there was a half standard deviation difference in cognition was either 1 year or was exactly the same. And that was consistent across all 4 measures like this. And so, go ahead. And so just to conclude, genetic risk has a nonlinear relationship with cognition across age starting in a person's 60s. Meaningful differences in age of cognitive divergence between the APOE score and the Alzheimer's polygenic score were not detected in this particular sample. Go ahead. So thank you to my co-authors and the funding that was that made this study possible.